Cubital Tunnel Syndrome is an irritation of the ulnar nerve, which is also called the funny bone nerve, as it passes behind the elbow. This nerve provides the sensation or the feeling to the fourth and fifth digits of the hand, and also controls some of the muscles in the hand, leading to weakness if it's not functioning correctly. The causes of cubital tunnel syndrome can be multiple. Sometimes stretching of the nerve can cause symptoms. Sometimes direct pressure on the nerve can cause symptoms. Also, sometimes the nerve can move on top of the bone called the medial epicondyle, which can irritate it, causing symptoms as well. The ulnar nerve symptoms are usually numbness, can be weakness, and also pain. If the ulnar nerve is irritated at the level of the elbow, numbness can be on the inside aspect of the forearm and into the level of the fourth and fifth digits. This is typically on the inner portion of the fourth digit and on the fifth digit as well. The ulnar nerve also controls the muscles in the hand, and weakness of certain motions can occur. Symptoms can be worse when the elbow is bent. The diagnosis can be made by tapping over the ulnar nerve or keeping the elbow bent to see if this reproduces symptoms. Also, by testing some of the muscles in the hand, the diagnosis can be made. Sometimes an EMG/NCV test can be obtained. This is usually done by a pain management specialist or a neurologist. This can show swelling across the ulnar nerve at the elbow or changes in the muscle that are supplied by the ulnar nerve. Initial treatment of this condition is keeping the elbow straight. This can be accomplished by placing a rolled towel around the elbow before sleep and trying to avoid pressure on the area. Sometimes an elbow pad can be helpful. If symptoms do not improve or there is associated weakness of the hand, a surgical procedure can be contemplated. The surgical procedure involves a small incision on the inside aspect of the elbow, where the tissue around the ulnar nerve is removed. The ulnar nerve will then be tested to see if it does move on the level of the bone adjacent to it. If this does occur, sometimes the ulnar nerve is moved into a more safe location where it can be allowed to heal. Usually after surgery, a splint is applied for 3 to 5 days to allow for decreased swelling. This is then removed and an elbow sleeve is obtained, and sometimes physical therapy is ordered. It usually takes 2 to 3 weeks to regain normal preoperative range of motion of the elbow, and the return of feeling and function to the hand and forearm is variable. Sometimes the sensation improves almost immediately, and other times it can take several months.